So understanding of the impact of menopause on bone health is so important. And why is that? Women are much more likely to be diagnosed with osteoporosis, and menopause does have something to do with this. Although we don't want fear to be part of a woman's perception of the menopause, if they need to be scared about anything, it is bone health. We want to raise awareness of the significance of osteoporosis and its devastating impact for many women. A book I would recommend is Dr. Jen Gunter's Menopause Manifesto. I'll leave the references, and it's got a very helpful chapter in it about bone health. So she describes that osteoporosis is a condition where bones become fragile, increasing risk of fracture. Osteoporosis means that there is a decrease in the amount of bone mass and microscopic alterations to the architecture. There are also some other changes in bone quality which we don't understand very well. Bone health is like a continuum. While osteoporosis reflects one end of the scale and the highest risk of fractures, many more women have low bone mass, which also increase the risk of fracture, but it's not yet osteoporosis. It used to be called osteopenia. We prefer not to use that term. So if you're in your 30s, you are losing bone while you are listening to this. Bone is a reactive tissue. It's constantly remodeling, meaning it's reabsorbed and new bone is laid down. In fact, your whole entire skeletal system bones are replaced about every 10 years. After a woman reaches her peak bone mass in her late 20s, we prefer you to have lots of money in the bank, so you've got some savings for the small bone loss that is to follow. In your 30s, your bone mass slightly tips in favor of bone loss, and there's a small but steady decline around 0.4% per year. So estrogen is a woman's main reproductive hormone and a major player in bone formation. The time of most rapid bone loss starts approximately 1 year before the final period, lasting about 3 years, and that is the time you move from peri to postmenopause. An average woman loses about 6% of her bone mass during this period, but it can be as much as 15%. After this period of 3 years, bone loss continues, but at a lower rate, although still at a higher rate than before the menopause, around 0.5 to 1% a year. It's not just menopause that impacts bone health. Age of menopause, alcohol intake, eating disorders, genetic, medical conditions like rheumatoid arthritis, type 2 diabetes also have an impact. Medication, lifestyle plays a part. Dr. Kalia, for instance, talked about vitamin D. So now, consider a woman, 65 years old. She's living independently and breaks her hip. 1 year later, she has a 50% chance of being unable to live independently and a 40% chance of being able to walk independently. It feels that there's still a cultural acceptance that it's okay to be a fragile old lady. And this obviously is very closely related to bone health. So why are so many women simply unaware of their osteoporosis risk and that there is preventative treatment? So our mantra is, aging is inevitable, fragility is not. So we want to change this societal acceptance that it's not okay to be a fragile old lady. The bottom line is that all women over 65 that are not on preventative treatment should be screened, and many younger women with any risk factor of fragility fractures also need testing. The good news is that exercise, nutrition and medication like hormone therapy is highly effective. Exercise can help bone health, muscles pull on bones, and weight bearing produces stress on bones. So exercise can make a massive difference even if you already have low bone density. Osteoblasts, the cell that builds the bones, are stimulated by mechanical signals from the exercise. And next time we'll talk a little bit more about exercise on low bone density. So watch this spot or ask reception to book in for a menopause MOT, and we'll look at advice on all aspects of you being at your best during the menopause and beyond. Thank you.